All right, Dr. Kyle. How are you, sir?
Excellent.
Excellent. So, question for you. What is the reason behind why you speak and train on health and human potential?
Ooh. There's so many different reasons behind that. Health, because I've been in healthcare. I'm a third generation chiropractor. I was raised by a chiropractor who was raised by chiropractors. On top of that, my father is somewhat of a philosopher, and anybody that's studied philosophy, and it doesn't matter if you're in modern philosophies, or if you studied Nietzsche, or you studied Plato or Thales, or you wanted to study Rumi or any of those, you find a certain amount of human potential that's bound up in that. And on top of that, I'm a student of the theater, and I'm a student of literature, and I'm a student of stories. And more than anything, I love stories. And if you study the history of stories, stories are about the potential of humanity in everything we touch. We can go back to the oldest myths of Gilgamesh. We can go all the way back. We can talk about the Greek myths. We can talk about everything we know about Proto-Indo-European languages and that, and the inherent stories that are in their words, and the cultures that we barely know about. I've been to the caves of Altamira in Spain, and I've seen 20,000-year-old cave paintings to tell stories of the hunt and stories to say we were there. And people think there were all this primitivity back then, but I go, no, look at the potential. They knew what they had. Maybe they didn't have the leisure time that we had. And I look at today's society, especially where we're getting this, oddly enough, disconnection, discommunication, the more we have communicative technology, like phones and AI and chats and that, and we're more disconnected and not communicating more than ever. And that's across all aspects of life. That's one big reason I love to go in. I'm trying to bring the story of humanity back to sort of a state of equality and balance, and get us out of this headspace where we think we need all this technology. Start to use technology as a tool, and start to communicate and share stories with others. And I see that as, kind of going on what Joseph Campbell said, that's something we can go after. And that's really what attracts me, not just speak on health, but how do we utilize that with human potential and tell the story of health and the story of humanity as one thing.
I love that. That's amazing. So, I mean, you might have already answered this, but what makes you different than other health experts?
Well, that again is, like you said, maybe that came up in the answers. First off, third generation. I was raised with a completely different paradigm of health, because I was raised with this sort of chiropractic view, which is vastly different. It's a vitalistic, it's a holistic viewpoint of what health is and how it encompasses life. Because in chiropractic, we don't talk about how, I'm going to adjust you and your physical problem goes away. It's, we're going to adjust you because of the way you interact with life is going to change if we do that. And Dr. B.J. Palmer said it well, that it's anything you say, think, or do today can affect the lives of millions tomorrow. And the way he said that is one adjustment on one segment, one time on one individual. That individual is then going to go forward, even if we don't have a chance to see them again. And because that interference is gone for that moment, they're going to be able to go out, and every single interaction they have for the rest of their life is going to have a different ripple, because now they're experiencing and expressing health in a different way with less interference. And that immediately brings it back. But I also have a background in ballroom dance, in Aikido, martial arts, with that philosophy from O-sensei. I've read over 13,000 books. I've studied multiple different ologies and disciplines. I study words, languages, the history of words. I've traveled half the world. I come from a place of theater and performance and story. That immediately, from most of the healthcare practitioners I've spoken with, very, very different and unique approach.
Wow, 13,000 books, huh?
At least.
Oof, I don't know if I've even made it to 1,000.
That's since I've been in Greece, I bought hundreds.
Wow, and you read them all?
Most of them.
Amazing, amazing. Well, if you could tell senior executive teams one thing, what would it be?
To start looking at everything. It's cliche, but it's get your head out of the box of we have to label everything. People get really caught up in labels. So when we talk about health as being a state of wholeness and we look at human potential, remember that corporation comes from the Latin for a condition or state of being a body. The same as health comes from a condition or state of whole being. And so your corporation is also an individual in that sense, that get out of the box of this physical and don't get into labeling and all these things. Really look and start to say, how can I see all the parts working together? The CEO, that's the job of the CEO. They're the chief execution executor. So they're the ones that are supposed to implement and execute the stuff and spread it out to the different teams the way the brain does in the body. But the CFO has the financial piece. So the CEO is going to look at all your executive board, and each one of you needs to see that. Now, each one of the senior executives does not need to be perfect on all that. They're going to stay probably a bit in their lane, but not having an understanding of what everybody else is doing so they can take themselves into account with the whole and present that as a unified vision and mission with that corporation and do that within themselves in whole being. You're losing out. That's where you start to see stuff go down, because you can't make adaptive change if you're coming from a place where you're stuck here in labels and rigidity. That's not adaptive.
So a holistic view.
A holistic viewpoint, looking out at everything all the time. And that's in any place you're in on the senior executive team. The chief financial officer, you don't need to be necessarily going over here and doing everybody else's job, but to just do your job and make yourself completely unaware of how all these pieces are interacting at the same time. Try to take that holistic view. Look narrow, look specific, and look general. That's holistic. We get to see all of it.
Awesome. Thank you very much, Dr. Collins.
I'll thank you for the time.
Very enlightening.